Some Massachusetts lawmakers say it's high time, pun not intended, to rein in prescription drug costs. And step one, they say, is making manufacturers explain why their drugs cost what they do. Pharmaceutical companies say it's not so easy, but as Stephanie Leyden reports, consumer advocates say it's what the public deserves.
At age 86, Kiki Shayton of Lynn gets where she needs to go. What she struggles to keep up with is the rising cost of prescription drugs.
$100 a month for 3 months in this bottle, $300, 3 months supply, where before I paid $45 a month.
It more than doubled.
That's right. $10 more than doubled.
Not only is she paying more for her cholesterol medication, but it's not even the brand name she took for years. She was switched to a generic version, and she says it has debilitating side effects. Her solution?
I told the doctor I'm not taking them anymore.
She's not the only one cutting back on drugs the doctor ordered.
And how long have you been without health insurance?
Boston-based Healthcare for All says callers to their hotline often struggle with a choice between paying for food or medicine. The organization is backing state legislation requiring drug companies to report pricing on their most expensive drugs.
We pay these outrageous prices for drugs. It's time that we had some knowledge about what goes into those prices. And that way the government and the insurers and us, the people, can look and see if they're fair prices, if they're price gouging or not.
Brian Rossman points to the price of EpiPens, a life-saving injection for allergic reactions that jump from $100 to $600.
Maybe that's appropriate, maybe that's not. What do they have to hide? The question we keep asking is, if the prices are fair, then why are you trying to keep them secret?
But MassBio, which represents drug manufacturers, says transparency legislation fails to take into account the complexity of developing drugs.
You could start out as a cancer drug and end up a cystic fibrosis drug. You know, how you could be 4 companies later by the time that drug gets to the finish line. Are you going to be able to go all the way back to when it was in a lab at a hospital or a university and track all those costs?
Robert Coughlin says, yes, drugs are expensive, but they save money by keeping people out of the hospital. And he says insurers should pick up a bigger part of the tab. At the end of the day, the consumer that needs the expensive drug is going to have to pay for the expensive drug.
Yeah, but that's what you have insurance for.
It was the metoprolol that we talked about.
But Kiki Shayton points out drug companies benefit from federal money.
The government is trying to help us some way, but it isn't working. It's not working the right way.
The legislation won't impact drug prices, but advocates say it could be an important first step. Stephanie Leyden, WGBH News.
State legislatures across the country are considering prescription drug cost transparency laws. The only state to pass one so far is Maryland, and that law is being challenged in court.